So we covered LED mostly already, but what it is basically a science that was developed by NASA to be able to grow plant life in space. So we found that the light therapy was beneficial in wound healing, cosmetically, and just like in, on Earth. And red light therapy itself was used for pain management. So the different colors of LED correspond with the different depths of the epidermis and the dermis. So that is why they are beneficial for different things. For example, the blue light is going to penetrate more superficially than red light. And the blue light, because it's superficial, it's going to be working on the things that are more superficial than the red light, which stimulates into the dermis, would be helpful for. So kind of just like a basic thing. If you want to watch the Selima PowerPoint again, that was like the video from the company. I can probably send it to you. I don't know if it's an internal link, but I'll look into that. But basically what we have, or that video is more Selima specific, like this is more in general, what I'm talking about right now. Basically in a treatment, we have two different types, handheld units and panels. Of course, the panels are more beneficial for us because we don't have to be holding something the whole time or having our client hold something, and you can just set it and go about our business doing other things like massage or, something else. But handheld units are helpful because they're smaller and usually cheaper, and you can sell them to your client for home care if they can't come in at the time. So usually services for LED are based on the studies. Like that first bullet point is based on studies that have been proven to show how effective LED is. So services are usually scheduled 1 to 3 times a week for 8 to 10 total treatments and maintenance. So that is not to say that you couldn't do once a week, but you'll get, or you could do once a week, but you'll get better results if you do it more frequently, up to 3 to 4 times a week. And that's why it's beneficial for your client to have a home device that they can use. So that they don't have to be coming in that many times a week. And again, this is based on studies for efficacy. So the frequency is going to be more helpful to get the results that you want. You can plan your client's treatments if they're getting something else done. For example, being able to market with or if you work at a medical spa, or if you know medical providers, offering LED services is helpful in recovery from things like laser and other things that promote light therapy and reduce erythema, which is just skin redness. And you can provide these services alongside other things such as peels, microdermabrasion, and microcurrent. So you can kind of do LED plus something else depending on the goal of the service, pretty much. So what those things have in common besides microcurrent are that microdermabrasion peels are like the exfoliation part of a facial, and LED would be more a treatment part of a facial, or something that you could do again during the massage. So after the exfoliation. And microcurrent is not exfoliation, but it is more of a, you have to be doing something manually for that service. So you could do LED afterwards to kind of wind down. And these are all just different options. You can determine what the best method of treatment is depending on your client's needs. So indications for LED include sun-damaged skin, mild to moderate acne, erythema from laser or light therapy, sunburns, and aging skin to promote collagen synthesis. pain, stretch marks, eczema, and enhanced wound healing are also found to be beneficial in treatment with LED. So the red light is the light that penetrates the deepest. So that's why it works with these processes like the cellular processes, the stimulation of ATP, and the boost of collagen and elastin production, because those things happen in the dermis, and the depth that the light can penetrate is in the dermis. It's also where wound healing happens. That's why red light is beneficial for them. Yellow light is a little bit above the dermal junction, and it reduces inflammation, it improves lymphatic flow, and it detoxifies while increasing circulation. Then the green light stimulates kind of the same dermal upper dermal junction, or the stratum basal or germinativum layer, which is helpful for hyperpigmentation because the melanocyte is found in that level of the epidermis, in the basal or the germinativum layer. It also reduces redness because redness is another kind of pigmentation depending on the melanin, and it calms and soothes the skin. Then the blue light is more superficial light. It's going to be stimulating kind of the stratum corneum, and that is where the P. acnes bacteria or C. acnes bacteria, same bacteria, the acne bacteria, is found. So the blue light reduces that bacteria. Rosacea also has different things going on in the stratum corneum that affect and cause the redness, such as the same P. acnes, also the demodex mites, all found on the upper layers of the skin. So contraindications for LED include seizure disorders, open or unidentified skin lesions, clients with autoimmune disorders such as HIV, AIDS, hepatitis C or B, or lupus, and clients using photosensitive medications, and pregnant clients. So photodynamic therapy is not something that we can perform as estheticians, but it is done in a medical setting. And this is because it's using a drug called ALA, amino luvulinic acid, or Luvolin. And this is a prescription drug that needs to be prescribed by a physician, of course. So that's why it's done in a medical facility or a medical spa. This treatment was initially done to treat actinic keratosis, which are just little scalies that come up in areas of overexposure to the sun or just like sun damage, usually in more mature patients, but it can happen in younger people as well. And it's been expanded to treat acne and other kinds of facial rejuvenation. For example, for acne treatment, you would apply the ALA for 30 to 60 minutes and then apply a blue light to it. The ALA is absorbed by the sebaceous glands. And then when you apply the blue light, it causes a phototoxic reaction, which destroys the acne bacteria, the P. acnes bacteria. So this is usually done in a series, and the sebaceous oil gland stops putting out as much oil, and acne is reduced. The bacteria is basically killed. But it also is, like I said, helpful for actinic keratosis. So things like post-care mentions here, avoiding the sun for 2 days after treatment, because this is photosensitizing. So you could experience things like hyperpigmentation if you don't avoid the sun after something like this, because it is so active. Here are some photos of actinic keratosis, which, like I said, are the little scalies that happen due to overexposure of the sun. So now we will move on to microdermabrasion. There are two different kinds of microdermabrasion, the diamond tip and the crystal dermabrasion, just from my experience, I have found that I hope, oh my gosh, I hope you can hear me. I just realized that my settings are wrong. Let me check on this. Okay, that's fine. Anyway, there are two types of microdermabrasion, the crystal and the diamond tip. And like I was saying, for the most part, from my experience, nobody uses crystal dermabrasion in the real world. Obviously, we still teach you, and we have both kinds of machines at Bellis, but usually everybody uses diamond tip microdermabrasion because crystal dermabrasion is kind of a hassle. So traditionally, when you guys still had to take the practical exam, you would be stimulating crystal dermabrasion, and you would have to wear goggles and a mask because the crystals that are found or that are used during crystal dermabrasion kind of are a nuisance. They've been called a nuisance dust by the World Health Organization because they kind of go, they're aerolized and they leak into the room. So you can either inhale them or cause eye damage, which would be why you would wear goggles or a mask as the practitioner, and also make sure that your client has appropriate eyewear and like that their mouth is closed basically while you're doing it so that they don't like absorb anything. But yeah, the crystals kind of like are more trouble than they're worth, to be honest with you. So we have it, we can show you, of course. Some people do like prefer it over diamond tip, but I have found diamond tip to be more effective and just like easier to clean up and to use. It's actually really quick, even though it might not seem like it is. So with diamond tip dermabrasion, we have our hand pieces and the diamond tips are kind of like in a little box. And if you haven't practiced it, I would suggest that you do, because you really need to be comfortable with it to be able to provide an effective service. So if you go into the little box where the tips are, you'll see on the sides that there is a number on the actual tip, on the sides of the tip. There is a number etched into the metal, and it gauges from roughness, so coarse to fine. Let's say that the boxes at school are from like 120 to 220. I would use a 220 on someone that had finer skin, not as thick of skin, over using a 160 on them because it's going to be more fine. Yeah, that's the right word. And I'm not going to cause any damage. So basically what both kinds of dermabrasion are is just exfoliation. You're removing some levels of the stratum corneum from the skin. And say that there's 20 layers in the stratum corneum. This is just an example. It all really depends on the person, the individual. But say that there's 20 layers in the stratum corneum. Microdermabrasion will remove maybe like 5 to 10 to 15, depending on how many passes, how heavy your hand is, and just like technique really. So you're not removing the whole stratum corneum. You're just removing some layers of dead skin cells that sit atop the stratum corneum. And you want to like continue the service. I don't know, you guys should have seen demos on this by now, but if you haven't, like, don't worry, we'll do some. But basically, everybody teaches it differently. I'm just gonna like kind of modulate what I would do. Up and out, and then just around the face. There are like little guides at school that you can like ask for like a little photo of the pattern, but you're basically just working from the inside out with the diamond tip wand. And once you finish that, really, it should take maybe like 5 to 10 minutes, depending on how once you're doing it. But once you're finished with that, you would just disinfect the machine and put the tips into the barbicide containers, like where we put brushes and such, and clean it. We do have filters, but also I've been told that we don't need filters because the waste goes into one of the little jars that's in the machine. So people do like to see their filters though, because people like to be grossed out by the skin that comes off of them, I guess. So here it says the benefits of microdermabrasion include reducing pigmentation. So that's true to an extent. To effectively treat pigmentation, you have to know why pigmentation is happening. So usually pigmentation is a result of trauma or just like overexposure to the sun, which makes, or like hormones even. So the melanocyte is found in the stratum basal layer, and it's producing the melanin that results in pigmentation that we see on the top of the skin. So first order of business would be suppressing the melanocyte activity with a tyrosine inhibitor, which would be ingredients such as kojic acid, licorice roots, some derivatives of vitamin C, and so on. Like I can give you a list at another time. But then the second thing would be microdermabrasion, because you're exfoliating. So I don't have my skin diagram, so I can't really like show you with that here. But let's say that the melanocyte is in the stratum basal layer. We have stopped it from overproducing melanin. So now all of the cells that are above that, going from the basal to the corneum, let's say that this is them, they are still producing, or they already produced the pigmentation that's found in the cells, but the newer cells that are being produced in the basal layer are not going to have the excess pigmentation. So when we're exfoliating, we're removing those cells from the stratum corneum with microdermabrasion, and eventually we'll get to a point where we have exfoliated all of the old cells that had the excess melanin in them, and all of the new cells that are being produced and moving upwards to the stratum corneum no longer have excess melanin in them. So that will reduce pigmentation. But sometimes we don't need to do that depending on why there's pigmentation. If somebody just had like a traumatic injury and like it was a one-time thing, sometimes you don't need to do a tyrosine inhibitor and you can just exfoliate. Usually microdermabrasion is beneficial and more of like a serious thing if you want to really see results. But yes, same reason why it's beneficial for scars. But keep in mind and note that it does say superficial scars right there, because more like deeper scars or like a textural issue is going to be something that's done in the dermis. So we can't change the structure of the skin, the dermis of the skin, by something that's being done in the epidermis. I mean, we can, but like not the stratum corneum, not exfoliating like that. So if something is superficial, more often than not, the problem lies in the skin cells in the epidermis. So again, that's why exfoliation through microdermabrasion is beneficial for that. Then it says produces collagen, resulting in supple skin tone and texture. I would disagree with that, just because more things are needed than exfoliation for collagen synthesis, but you can stimulate collagen production through the wound and heal method, meaning like some kinds of exfoliation, such as microdermabrasion, would be considered a wounding, which would stimulate collagen synthesis. If other things are already, like say collagen synthesis is a recipe, there needs to be different ingredients besides exfoliation, which I can go over some other time. But it's kind of just like a list of different minerals and amino acids that need to be in place for collagen synthesis to actually take effect. So as I mentioned earlier, your technique is going to be what makes microdermabrasion most successful. There are different kinds of machines that are used by medical professionals, as well as the ones that we use. And the ones that are used by physicians are just more intense and kind of remove the whole epidermis rather than just the stratum corneum, which is why we can't really use them, because like you would not be, it's like considered a medical thing, because you would be in dermal layers, which are like the layers that have blood cells and such, and we just can't work in the dermis. So here are some variables: number of passes, the strength of the vacuum. At school, the machines there, I wouldn't go over 20 in the gauge of the machines at school. Sorry. You can still get like a good dermabrasion done at that level, so don't worry, like it'll happen. But you want to be aware of the suction that's coming out of the vacuum when you're doing the passes. And depending on how thick someone's skin, that would determine how many passes you go over the skin. I wouldn't do more than like 2 or 3 unless someone had like a lot of wrinkles, and then it's almost like you're ironing them out when you're passing through those areas. So you don't need to do like 5 passes on the whole face. If you're just focusing on like someone's like crow's feet, for example, I would just focus on the lines here. And the speed of the pass is going to be a factor in the pressure. So you'll know what I mean if you've done this before, but if you haven't done this before, you could always do it today. If you want to see a demo, maybe one of the teachers can do it for you today, but I'll be back, and we can just plan out these things. You know, you'll get a demo, don't worry, you haven't seen it yet. But you'll notice here it says too aggressive of a pressure can result in bleeding, redness, infection, and hyperpigmentation. So really, diamond tip microdermabrasion, is more appropriate for more delicate and sensitive skin because you're not using the abrasive crystals to exfoliate. The crystals that are found in the diamond are very fine, even though I just told you about the different levels of porousness in them, they are still fine and they're not going to be that damaging unless you are being too aggressive with the skin itself. So I have some examples of this. Here are some things that can happen. I think this is the same lady. I just Googled microdermabrasion horror stories and this came up, and you can see how like it kind of like tore her skin, which can happen. I've never had it happen to myself. One of my students did do this to her mom a few months ago, but why that happened was because her mom was on retin-A and she had not stopped using it, or like a retinol. I don't know if it was retin-A or a retinol, but she had continued using it, and the student did microdermabrasion on her without really consulting properly, basically. So you want to make sure that actives and like more strong topical products have been suspended for at least 3 to 5 days before you do dermabrasion or microdermabrasion, because it is you're removing skin cells. So you want to make sure that it's not too sensitive skin. Also, I just remembered this, or it just came to my head. The medical treatment is not called microdermabrasion, it's called a dermabrasion. So let's see. Some good things to keep in mind for your technique would be holding the wand at 45 degrees over 90 will be less likely to cause scraping, and you want to, if you feel when you're practicing that it's too long, the stroke, you can always break it up. Another thing is to make sure that you're holding the skin taut as you're moving through it, just so that it doesn't bounce back or you don't suction it too much. Some things that can also happen are that you're suctioning too much and you make someone get like a hickey or something. So things to keep in mind. I have a video to show about this.
A few months ago, I got my routine microdermabrasion and chemical peel. Little did I know the esthetician was going way too rough on my face and left me like this. After I had a mental breakdown, I knew my skin needed immediate attention. That same day, I went to a different medical spa and started a new treatment plan. For the last few months, I've been doing red light therapy, dermaplaning, and microneedling. My skin actually started healing really fast. I'm sharing this with you because I don't want this to happen to anybody else. Do your research, find somebody you trust, and be careful. A few chemical peel. Little did I know that.
I noticed that machine was like a retail machine. So another good thing to keep in mind is that you buy your professional machines from a professional supplier. And I don't even mean so many of the suppliers that you can find on like Instagram ads that just buy all of their machines from like China and mass produce them here, because no. But I mean like these kinds of at-home devices. And most of the time the suppliers that mass produce things from China are scamming you. So yeah, you want to make sure that you are getting your machines from a reliable source. Anyway, so the crystals in crystal devices are aluminum oxide crystals, and they were chosen initially because of their power in exfoliating the stratum corneum, but they do have disadvantages. Like I mentioned, the dust that's created or the crystals going all over the place, as well as some machines allowing the crystals to be aerosolidized, which are microscopic airborne crystals. So it just creates like a whole mess of things, but typically the crystals are not going to cause skin irritation. But the diamond tip still is better for sensitive skin or more delicate skin. So indications for microdermabrasion are bone damaged skin, hyperpigmentation, sallow skin tone, meaning like, what's the word? Like dull, like a dull appearance, acne scarring, rough or coarse texture to the skin, and seborrheic keratosis, which are these guys. These are not non-benign lesions as long as you know, and you can't really remove them in California, but in some states you can as an esthetician. But these are called in the medical field just abbreviated as SKs. And when I worked at a dermatology office, not me, but the doctor would also just remove them with nitrogen, like freezing them off. So yeah, they're not benign, so they're not cancerous, and they're kind of just there, and people want them removed most of the time. So again, not something that you can really touch, just because sometimes they will bleed. So again, we can't work in the dermal layers, which is where the blood supply is found. So some estheticians have machines that they can use to remove these in other states, but microdermabrasion, I would say, unless it's superficial, like this one looks more superficial than like that guy, or even this one, or even this one. This one looks more superficial. I would say that the more superficial ones, probably, maybe you can remove them with microdermabrasion. So, contraindications for microdermabrasion are rosacea or sensitive skin. And I know I just said that diamond tips fine for sensitive skin, but with rosacea in general, you just don't want to like aggravate the skin usually. It depends, it's a case by case basis. With bacterial infections, you don't want to spread any bacterial infections. So that's the case also with viral skin infections. fungal skin infections and open lesions, such as inflamed acne, pustules, or cysts, or nodules. You don't want to spread any bacteria on your tip or on the face. Dermatitis, you don't want to exfoliate really, because they need more like moisture to be able to control that, not water, but like ceramides and things of that nature. And also, if you exfoliate with dermatitis, you can make it worse. Pregnant clients, I would say it's fine for pregnant clients, but you want to get like doctor's approval first, just to be safe. Then immediate post-operative cosmetic facial surgery, it would be a contraindication because you don't want to work on anybody if their skin is not fully healed yet. And then use of Accutane within the past year. I don't know if I said this, so I've recorded maybe like another 2 versions of this. So I don't know if I said it in this version, but Accutane suppresses all oil production in the skin. So it makes your skin really dry. So that's why usually we are not supposed to be working on anybody with like stronger ingredients or devices that has been on Accutane within the last year, because we need to give the body time to re-regulate the oil production and kind of like make sure that it's fine to be exfoliating at all. We don't want to like make someone that's too sensitive. We don't want to exfoliate their skin basically. But I will say that more hydrating treatments are fine with Accutane if you're not using anything that's harsh to exfoliate. Sometimes I wouldn't even exfoliate if someone is just coming to me that has been on Accutane and they're seeking relief, like they want hydration, not things that are going to continue to strip their skin. So ultrasonic technology is used by estheticians, and this is different than ultrasound. So ultrasonic technology is like your spatulas, your skin scrubber, your little BT micro machine that you got. This provides cleansing exfoliation called cavitation. So this is where the implosion of a water molecule in the skin serves as a mini pressure washer. And you can also use it for the penetration of products called sonophoresis. And in some units, microcurrent is available in the unit, which is used to promote homeostasis. So for cavitation, the spatulas is used with water or water-based cleanser to perform a deep cleansing. And the technology uses sound waves, not an electric current, to exfoliate and dislodge any surface contaminants and loosen the impurities embedded in the follicles. The minute vibrations loosen the stratum corneum cells, and some manufacturers claim up to a 35% reduction of the stratum corneum is reduced in one treatment. During this treatment, it's important to maintain constant movement of the handpiece on moist skin. Leaving the handpiece on one section of the skin for too long can cause excessive heat buildup and unstable cavitation. So this is a very gentle, non-abrasive procedure, and it is suitable for clients with rosacea, more so than microdermabrasion or other exfoliating services. It's also suitable for clients with sensitive skin, and you're not going to experience a lot of redness with this. So contraindications for this, let me see if there's another slide. Yeah, include heart conditions, pacemakers or electric implants, pregnancy, and diabetes. I have a video. I'm going to let it run, and then I'm going to say something or say stuff. So you will notice that the first step, the exfoliation step, she's removing a mask with the exfoliation setting on high. So that's the first button on your spatula with the spatula facing, I guess, down. Let me just verify. Up. Yeah, down. So like the little curve is facing downwards and kind of just like almost scraping the skin, but that's the wrong word because it like implies aggression or roughness, but it's not a very aggressive thing at all. Then she is using the other side to, so this is their version, biotherapeutics version of a desincrustation solution called decongest. So it's used for deep cleansing and for extractions. She's using, let's see, the clear setting, which is the fourth button, on high to penetrate the desincrustation solution with the opposite angle of the spatula, if you notice here, with it facing down now. And that is not for the actual extractions. She's just using that to penetrate the desincrustation solution, which is going to help loosen up any sebum or blackheads and such. Then for extraction, she's going back to the first exfoliation setting. First button, and I don't know if she goes low. It looks like she did. But high is fine too. Like, oh, she is on high actually. Okay, cool. And you'll see here, I don't know if it's gonna zoom. It's not gonna. But she's going in and like there's some other videos on their Instagram where you can see like really good extractions with this. And that's pretty much it. She's using this again on the second one, which is serum to penetrate, and you can see how she's using it backwards again. So yeah. I have mentioned to you guys before that I have also seen estheticians extracting with the spatula facing downwards. I think it just comes down to personal preference, but for product penetration, definitely this way over the other way. Contraindications for this include damaged skin or fragile skin, being too close to the eyes, heart conditions, pacemakers or electric implants, pregnancy and diabetes. Diabetes is often mentioned just because of the slow wound healing that comes with the disease. So as mentioned, newer handhelds that are cordless also include microcurrent technology for added benefits of iontophoresis, which is the product penetration. And that's like the one that we have. So ultrasonic technology creates the cavitation and a natural peeling. Microcurrent is also blended with this technology for both positive and negative ionization, meaning either iontophoresis or desincrustation. Then there's other devices that are called medical ultrasonic paddles, which are I couldn't find any photos, so I'm sorry, but they are vibrating medical paddles, which are aggressive and therefore more suited to the medical arena. They are large, abrasive, vibrating paddles that are proven to cause elimination of 75% of the stratum corneum in one session. So again, this is called medical ultrasonic vibrating paddles. Microcurrent is used to treat skin firming and toning and in ionization and desincrustation. Studies have shown that microcurrent also stimulates ATP, which is the biocatalyst for all cellular processes like DNA replication, oxygenation, and respiration. muscle movement and neurotransmission. Microcurrent can stimulate blood circulation and lymphatic flow and upregulate collagen and elastin production. Microcurrent is a low-level current that mimics the body's own natural electric rhythms, and it operates on a low-level current measured in microamperes. Some devices incorporate Hertz technology, which is cycles per second, expressed as frequency, meaning that the number of occurrences of the current in the device's program is at certain speeds. This feature is instrumental in directing the low-level electric current to determine whether it's firming and tightening the muscles for lifting and toning, like with iontophoresis, promoting product penetration and desincrustation. So usually there are two probes that you work on the muscles with. We did a activity naming them facial muscles and a microcurrent demo. So if you need help with the microcurrent or with the facial muscles, you can review your muscular system section in Pivot Point, just the basic anatomy one for the muscular system, just for the face, of course, and that will have all of the facial muscles for you. If you were not there during our muscle assignment during class, all we did was go through the facial muscles in the direction with which you move the probes in. So if you need that, just let me know and I can send it to you. So indications for microcurrent would be reduced facial elasticity. You can raise the eyebrows and tighten jawlines and reduce submental chin elasticity. So often microcurrent is just used for facial tightening and kind of giving a facelift effect. But depending on the machine, you can also use it for treatments with acne and other kinds of conditions because of the production of ATP and other benefits such as the inhibition of cytokine activity that cause inflammation. And that's not something that's going to be on your exam, so I'm not going to go over it in too much detail. But if you have any questions on that, you can just ask me. Contraindications for microcurrent include open wounds, cancerous lesions, heart conditions, pacemakers, muscular diseases, epilepsy, advanced diabetes, and pregnancy. And also any other like metal implants. Same with most of the electric modalities that we have. But with microcurrent specifically, some of these are because we're penetrating the body with. Electrodesiccation comes from the Latin word that means to dry. It's a device that uses low-level radiofrequency current to create heat that evaporates cellular fluid, neither causes blanching of the target or vasospasms, or results in dark coagulated vessels. The treatment is specific and results in minimal skin reactions or collateral tissue damage. The units use an external probe and gel to conduct the energy on the surface of the skin. The probes vary in size, and the smaller probes are used for the facial area, and the larger probes are used for the body areas. So the current evaporates cellular fluid and blanches the target. And these are radiofrequency devices that are not in scope. So keep that in mind. Too much heat can lead to damage such as scarring or hypo and hyperpigmentation. So this is a low level radiofrequency current to help remove minor skin irregularities. Indications would be milia, sebaceous hyperplasia, telangiectasia, skin tags, cholesterol deposits, and cherryangiomas. And contraindications are open wounds, high blood pressure, pregnancy, heart conditions, pacemakers, muscular diseases, epilepsy, autoimmune disorders, and metal implants. I believe the bullet point that's advanced aesthetics means, I think, cut off. I think it's advanced aesthetic procedures. So if someone had like facial surgery or any filler or other injectables, you would want to wait until everything is healed and settled for this treatment. And earlier when I said that it is not in scope, I mean in California, some states will allow you to use this kind of machine. Then dermaplaning is a manual exfoliation technique that is performed using a surgical blade, and it removes like the peach fuzz and the stratum corneum. I would say dermaplaning removes all of the stratum corneum, whereas microdermabrasion just removes some layers of the stratum corneum. Sometimes a chemical peel is applied after dermaplaning because of the same reason. Again, I don't know if I mentioned this in this version of this recording or in the previous ones, but when I was talking about microdermabrasion, I was saying how you can do different things depending on what you want. So I could do like an enzyme, a peel, and microdermabrasion, depending on what the result was. If I wanted the acid from a chemical peel to penetrate deeper, I would do microdermabrasion first and then do the chemical peel. So that's the same idea with dermaplaning. We would do dermaplaning first and then the chemical peel because we're removing the stratum corneum or layers of the stratum corneum, like with microdermabrasion, and then the acid is going to penetrate deeper. And if I didn't mention this during the microdermabrasion section already, if someone was more like congested and they had like bumps underneath the surface of their skin that you couldn't really extract, I would do a chemical or enzyme first because the enzyme is going to like digest those dead skin cells, or the peel is going to kind of like leave kind of a clean slate for you to be able to do the microdermabrasion on and kind of get more reduction in those kind of underlying lesions. So same idea with dermaplaning. If we're dermaplaning first, we're removing that layer of skin and the chemical peel is going to penetrate deeper. Then skin needling, microneedling. It's also called collagen induction therapy. Or derma rolling, depending on the device. There are like handhelds that are different than derma rolling, but the idea is the same. Like you're taking the needles and piercing the dermis with them to create the wound response that stimulates growth factor and fibroblast activity for collagen and elastin production. And this is an advanced treatment that we cannot do in California because we are penetrating the dermis when we do skin needling or collagen induction therapy or microneedling, all the same thing. So we can't do this in California, but it is a really great treatment, especially for acne scars or reduction in fine lines and wrinkles because of that collagen and elastin production. So how I mentioned when we were doing microdermabrasion, the benefits for that were superficial scars. So skin needling would be your next bet for deeper scars because you're actually penetrating the dermis and stimulating collagen and elastin production by doing so, which will stimulate like that foundational layer of the skin to kind of restructure itself. Unfortunate that we can't do it in California, but I have found good results from doing microchanneling, which is needleless. And what I have found is if I am like injecting, for lack of a better word, or laying vital like skin nutrients needed to stimulate collagen production, and I am going to be doing microchanneling, I'm still able, sometimes depending on the actual depth of the skin, I'm still able to reach the dermal epidermal junction or the stratum basal layer just above the dermis. So if I'm giving the skin the nutrients that it needs and penetrating them into the stratum basal layer, there are vascular papillae that are just underneath the basal layer that are kind of like how we get nutrients from the dermis. So if I do that, I'm able to also feed the dermis ingredients that it needs and stimulate collagen synthesis through another method, if that makes sense. I hope it does. That's not on your test. That's just me talking. Let me make sure I covered everything. Okay, I did. Thank you guys, and I'll see you later. Again, the test is just 14 questions, and all of them are covered here. Bye.